And joining us again via Skype, Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you very much for being here again.
Thank you.
That number seems to be going up. That number, by number, I mean the number of hospitalized, seems to be going up some days and down some days. But our read is it seems to be kind of holding. Are you reading it the same way, that we're kind of holding at the same level for hospitalizations?
It is, and we've kind of seen that with our last few jumps. So we held for a little while and then had a significant increase up into the 125s. And so, you know, what we know is that we're kind of leveling off and we're really at a critical point. So what we do now within the next couple of weeks, we'll start to see in hospitalization. So is that number going to go back up because we've let up? Or are we going to be able to keep this number going down and going in the right direction?
I want to talk to you about some new data reporting, it seems new data, or at least updated reporting from the CDC when it comes to deaths and COVID-19. And many of our viewers are seeing this in their social media feeds. And I'd love your take on this. The essential message was that a vast majority of COVID-19 deaths are among people who have comorbidities, which is, by the way, a word most of us had never heard of a few months ago, but now we know that means they had some underlying or pre-existing condition like heart disease or diabetes, lung problems, things like that. But that most deaths were people who had those comorbidities, and that only like 4 or 5% had no condition other than COVID-19 at the time of death. Did that surprise you, that data piece that seemed to come out recently into prominence?
It did not surprise me. It's what we've been saying. It's what CDC's been saying all along, is this disease can kill anyone. We know that the higher risk are those that have underlying health conditions. And so I think there's been a lot of misunderstanding of this data out there today. And I really want people to step back and understand, you know, I think when people hear comorbidities, they think of extremely sick, extremely older people that are near death's door anyway. And you have to understand comorbidities are the majority of us. So asthma and diabetes and high blood pressure and high cholesterol and, you know, even things that you're controlling with medication, if you get COVID, you're at higher risk, you pass away, your death certificate will list those other comorbidities. That's not specific to COVID. That's with any death certificate. If you've ever seen one, it will list all of the chronic underlying health conditions.
But there's this insinuation, and much of it's on social media, and I know you're seeing this, that the COVID-19 deaths are being over-reported, that people are dying with COVID-19, but not because of COVID-19. What's your take on that? That sort of thought that's out there that this is all a big blow-up over something that shouldn't be this greatly stated.
Yeah, I mean, it's been a frustrating day for me. So, you know, I think somehow it's allowed people to minimize these deaths and say that they're not important just because they had an underlying health condition. You know, if people have asthma, I don't think they're expecting to die next week because they have asthma. And so, you know, we've got to understand that if you get COVID and you have asthma, you may have a higher risk of death. If you get COVID and you have, you know, diabetes or some of these other things, then that's going to increase your risk. And one other thing, if you looked at that list, the number one comorbidity was pneumonia. And so that's a comorbidity caused by COVID. So COVID caused the pneumonia that caused the death. COVID caused the cardiac arrest that caused the death. And so you really have to understand the data and understand what you're looking at.
And while we're tackling the latest sort of social media buzz, it also insinuated in all of this discussion, it seems, is this idea that there's somehow, somewhere, an incentive to over-report deaths, that maybe even hospitals are incentivized to over-report. I'd love your take on that.
We're really not. So the treating physician is who fills out the death certificate. So the physician who has cared for that patient, who has been with that patient throughout their course, who is filling out that death certificate. They have no reason to lie. And if you look at other statistics that are out, we know that currently, this year compared to last year's baseline, there's 200,000 excess deaths in the United States. And so compared to baseline, more than 200,000 people have died than they did last year. And so we know what that tells us in the epidemiology world is that we're underreporting COVID.
That seems the evolution of this discussion now is And I've seen even pictures of this, of burn your masks. You know, we need to stop wearing, this is the cause, this is justification to stop wearing face coverings. I'd love your take on your response to hearing that. Maybe that's why you're feeling a bit of frustration today?
Yeah, it is. I mean, one of our CEOs said it best today, you know, as we're trending down, now is the time to double down. So, you know, as we're in our region starting to see a little bit of a decrease, although it seems to be creeping back up right now, you know, as we've had mask mandates and people have been doing the right thing, we've seen it work. We've seen our numbers start to come down. You know, if we stop right now, we're still working 40, 50, 60 new cases a day sometimes. And so there's still a lot of virus in the region. If we let up, the numbers will go back up, and we're just going to stay on this cycle. So it's more important now than ever that we continue masking, we continue hand washing, we continue social distancing, and we start thinking about getting our flu shot.
And flu vaccine season is here. I know that this year especially, you're always a big advocate of the vaccine. How about this year?
Now, it's really important this year, and I don't want people to hear that and think, oh, it will help me not get COVID. What it does is it keeps one respiratory disease circulating hopefully a little lower. And so if you come in with respiratory symptoms, with fever, cough, all those things, is it flu, is it COVID? So we really need people getting that flu shot to hopefully stay healthy, not get flu, and then help us really understand how to treat patients and what they have and where they need to go in our hospital.
Jamie Swift, thank you very much for your perspective. As always, we very much appreciate it.
Thank you.